Welcome to the image analysis of the hand. Let's start with the PA projection of the hand. Image analysis guidelines state that the soft tissue outlines of the 2nd through 5th phalanges should be demonstrated uniform. Distances between the metacarpal heads should be equal. Equal midshaft concavity is seen on both sides of the phalanges and metacarpals of the 2nd through 5th fingers. The thumb should demonstrate a 45-degree PA oblique projection. There should be no soft tissue overlap from the adjacent fingers. The thumb should be in close proximity to the hand. The interphalangeal, metacarpal phalangeal, and carpometacarpal joints are demonstrated as open spaces. The phalanges should be demonstrated without foreshortening. The 3rd metacarpal joint should be demonstrated at the center of the exposure field. The phalanges, metacarpals, carpals, and 1 inch of the distal radius and ulna are all included within the exposure field. The next slide states all the image analysis guidelines we just went over. So let's talk about hand rotation. Typically, if the hand is not fully extended and brought in a flat flat against the IR, but is slightly flexed, it will typically rotate externally. In external hand rotation, you'll see narrowing or slight superimposition of the 3rd through 5th metacarpal heads and unequal soft tissue thickness with midshaft concavity on the sides of the phalanges. Also, the metacarpals show unequal midshaft concavity and spacing. Typically, you're going to see external rotation rather than internal hand rotation, and that is because the thumb prevents that internal movement. In the next projection, you see excessive finger separation, and the reason why we deem this as a positioning error is because with that excessive finger separation, you're going to have to include a wider field of view. If you bring the fingers together, you'll be able to collimate more closely and bring out that detail in the image and reduce patient dose. Let's look at our first PA hand practice analysis. When you take a look here, we can see that there is some unequal midshaft concavity on either side of the phalanges. Also, there's like uneven spacing between the metacarpal heads here. The hand is in external rotation. Also, you want to take a look at how much the distal forearm you have on the projection. We're getting ready to clip it here in this projection, so you want to make sure that we keep the collimation open enough to include 1 inch distal to the forearm. Also, again, you want to keep that hand that palmar surface flat with the IR so that we get that true PA projection. In our second practice analysis, you can see that there are some closed joint spaces here. Also, you have some foreshortening of the phalanges. This projection is demonstrating a flexed hand and fingers. In order to correct the imaging here, we want to fully extend those fingers to open up those joint spaces and to get that hand, that palmar surface parallel with the IR so that we can get a true PA projection. This third practice analysis of the PA hand, I wanted to include so you could see the 2-part IR misalignment. With the thumb fully extended, it causes your central ray to be redirected to the second metacarpal phalangeal joint space. So, image analysis or Merrill's tells us central ray should be at the third metacarpal phalangeal joint. So in order to correct this, bring that thumb back in and closer to the hand and center your central ray to the third MCP joint. Is this a repeat offense? No, but you want to be cognizant of your positioning so you can have the tightest collimation as well as appropriate centering. Let's move on to our PA oblique hand projection. Image analysis guidelines for the PA hand oblique projection state that each of the second through fifth metacarpal midshafts should demonstrate more concavity on one side than the other. The first through second metacarpal heads should not be superimposed. The third through fifth metacarpal heads are slightly superimposed, and only a small space is present between the fourth and fifth metacarpal midshaft. There is no soft tissue overlap from the adjacent fingers. The thumb is in close proximity to the hand. The interphalangeal and metacarpal phalangeal joints are demonstrated as open spaces. The phalanges should be demonstrated without foreshortening. The thumb is in a PA oblique projection. The third metacarpal joint is at the center of the exposure field, and distal phalanges, metacarpals, carpals, and 1 inch of the distal radius and ulna should be included within the exposure field. The next slide represents the image analysis guidelines. So let's take a look at some PA oblique projections with inadequate positioning. In insufficient hand obliquity, where the hand is positioned less than 45 degrees, the metacarpals relationship is similar to that of a PA projection and of the hand, with the midshafts of the metacarpals closer to being evenly spaced, and the metacarpal heads are seen with less or without any superimposition. In excessive hand obliquity, where the hand is rotated more than 45 degrees, the space is obscured, and the fourth and fifth metacarpal midshafts demonstrate some degree of superimposition, where there should be a small space seen between the fourth and fifth metacarpal shafts. In this instance, we are excessively obliqued. So let's take a look at this first practice hand analysis. We can see that automatically there's a rotational problem. When you look down here at the fourth and fifth metacarpal midshafts, they are nearly superimposed here. That should automatically indicate to you that we are in excessive obliquity. Also, the phalanges here are foreshortened and the interphalangeal joint spaces are closed. This means that the hand, when fingers were in extension, all the fingers were still touching the IR. We need to make sure that the hand is up and that the fingers are in a 45-degree oblique and that they are positioned parallel with the IR. Also, for this excessive rotation, you want to make sure that you internally rotate that hand until it is at that 45-degree angle with the IR. Let's move on to the fan lateral projection of the hand. Image analysis guidelines for the fan lateral hand projection state that the second through fifth metacarpals are superimposed, the second through fifth digits are separated, demonstrating little superimposition of the bony or soft tissue structures. Thumb should be demonstrated without superimposition of the other digits and is in a PA to slight PA oblique projection. The interphalangeal joints are open. The phalanges are foreshortened. Are not foreshortened. The thumb is positioned close to the hand, and the metacarpal phalangeal joints are at the center of the exposure field. The phalanges, metacarpals, carpals, and 1 inch of the distal radius and ulna should all be included within the exposure field. The image analysis guidelines are as follows. When looking at the fan lateral projection of the hand, you want to make sure those mid shafts of those metacarpals are fully superimposed. And in this instance, we have a projection of internal rotation and a positioning error of external rotation. In internal rotation, you will see that the 5th digit is posterior and its metacarpal is posterior to the rest of the metacarpals. Also, you can see the first digit and its metacarpal is anterior. So that is where the patient's hand is in internal rotation. You need to externally rotate that hand until the metacarpals and the radius and ulna are superimposed for a true lateral projection. And in external rotation, you'll begin to see the 5th metacarpal in profile right here. And when you do see this, you'll know that you're in external rotation where you're over rotated. And you also will start seeing the second metacarpal posterior to the 5th. In this first image analysis, we can see that there is some rotation here in the metacarpals. They are not fully superimposed. You can see that the 5th metacarpal here is coming down, or phalange, and then the metacarpal is anterior to the rest of the hand here. This lets me know I'm in an external rotation. So in order to correct this positioning error, we need to internally rotate that hand until the metacarpals are superimposed. Also, the fingers are slightly superimposed too. This may be due to some of the external rotation, but you want to make sure you adequately get those fingers separated for a true fan lateral. In our next image analysis, the lateral hand, we have a couple positioning errors. First, we can see some superimposition of the soft tissue by both fingers, the first and second digits touching each other. Also, the metacarpals are not superimposed all the way here. The 5th metacarpal here is demonstrated anterior to the rest of the metacarpal, letting me know that I'm in a slight external rotation. And we don't have the fingers truly in a fan lateral projection. Some of them are superimposing each other. So we need to separate these fingers. We need to internally rotate that hand until it is the metacarpals are superimposed, and we need to separate the first and second digits to open up those joint spaces. This concludes the hand image analysis. If there's any questions, please feel free to reach out. Thank you.